Hello, my name is Dr. Cynthia Phillips, and I am the National Historian for the Rokai Society. The Rokai Lecture Award encourages and recognizes outstanding achievement from those in the fields of arts, letters, or sciences who have made significant contributions to the health professions. Recipients display the ideals of the society, including excellence in intellectual achievement and highest standards of conduct and character. It is a great honor for me to introduce the 2022 Rokai Lecture Award recipient, Dr. Jean Nappi. Dr. Jean Nappi is a nationally recognized intellectual leader, clinician, mentor, and educator in pharmacy practice. Throughout her 40-plus year history in academia, Dr. Nappi has been at the forefront of pharmacy and postgraduate residency training. Dr. Nappi received her Bachelor of Science in Pharmacy at the State University of New York at Buffalo and her Doctor of Pharmacy degree at the University of Texas at Austin and the University of Texas Health Science Center in San Antonio. It was there where she completed an internal medicine specialty practice residency in clinical pharmacy. She began her career in academia at the University of Wisconsin and taught at the University of Utah and the University of Houston. She is a professor in the College of Pharmacy as well as the College of Medicine at the Medical University of South Carolina. As a nationally recognized leader in pharmacy, Dr. Nappi has served as president of the American College of Clinical Pharmacy, where she was the first female president. She was elected to the Council of Faculties as the representative at large to the Board of Directors of the American Association of Colleges of Pharmacy. She has been a residency surveyor for the American Society of Health Systems Pharmacists Commission on Credentialing. Dr. Nappi's dedication to her clinical practice in cardiology, with expertise in heart failure at the Medical University of South Carolina, is legendary. She collaborates interprofessionally to care for patients and those in the congestive heart failure clinic. She is a multiple recipient of the MUSC Clinical Services Recognition Award and has received the ACCP Clinical Practice Award. As a passionate educator, Dr. Nappi has an extraordinary devotion to teaching. She has received the ACCP Education Award and the AACP Robert K. Chalmers Distinguished Pharmacy Educator Award. She served as director of the Pharmacy Residency Program for 5 years and as the director of MUSC's Pharmacotherapy Residency Program for 10 years. Her mentorship of pharmacy students and residents who have become educators and scholars leaves a long-lasting legacy in pharmacy practice. She pioneered the Academic Preparation Program, which prepares pharmacy residents to work as educators throughout the residency programs in South Carolina. Dr. Nappi is a devoted scholar with substantial contributions to the pharmacy literature. She has published over 122 peer-reviewed articles and written 31 book chapters. As one of her nominators stated, Jean is a force. She is brilliant, speaks directly on matters of importance, is not shy about taking the lead on major initiatives, and always sets high expectations for her students, fellows, and colleagues. I greatly admire these traits, and am confident these are among the many reasons she is so highly regarded by her students and colleagues across academia writ at large. Please join me as we listen to the 2022 Rokai Lecture Award recipient, Dr. Jean Nappi, as she presents Reading Tea Leaves.
I'm thrilled and honored to be asked to give the Rokai Lecture in 2022, which is the 100th anniversary of Rokai. It was nearly 50 years ago, in June of 1972, that I was inducted into the Omega chapter of Rokai while I was a pharmacy student at the State University of New York at Buffalo. Rokai was the first professional pharmacy organization that I joined, soon to be followed by ASHP, AACP, ACCP, and several other state pharmacy and medical associations. All of the professional organizations I've been associated with have contributed to my growth as a healthcare professional, and I encourage you to take advantage of whichever pharmacy organization calls to you. ROCI recognizes and rewards outstanding attainment through its college chapters and thereby encourages and stimulates outstanding scholarship. I want to congratulate each of you for what you've achieved thus far, but I hope you realize that this is only the beginning, and I hope to see you accomplish much more. There are a lot of professional organizations to choose from, and your interests will likely change over the course of your professional career. But please stay active. All professional organizations need active members and leaders. As I looked at the previous individuals that have presented the ROCI Lecture Award, I noticed that several of them have had a direct impact on my own career. Doctors Gerhard Levy and David Triggle were two of my professors at SUNY at Buffalo, where I received my BS in pharmacy degree. James DeLucio was dean at the University of Texas, where I was a PharmD student. Then as a faculty member, I was influenced and had the privilege of working with Deans George Zagrafi at the University of Wisconsin, Hal Wolf at the University of Utah, and Joe DiPiero at the Medical University of South Carolina. I've also had the opportunity to know and work with Dick Penna, Marianne Coda Kimball, Milap Nahata, Bill Evans, Jim Cloyd, Mary Ensom, Henry Mann, and others through AACP and ACCP. And I'm truly honored to be among the recipients of this very special recognition. Generally, when asked to address a group like this, the speaker is expected to reflect on past and present day scenarios and perhaps contemplate what the future might bring. So I plan to do a little looking back and a little looking forward in these next few minutes. My mother was born in Scotland and immigrated to the United States shortly after World War II, at the end of World War II. And she told me that my grandmother used to read tea leaves. Now, I don't read tea leaves. I think it's very hard to predict the future, and I do not have a clear vision of how pharmacy or healthcare will transform over the next 50 years. But I'm certain it will change, and you will need to be prepared to change with it. This image is of a pharmacy circa 1922, and it resembles the Pitt Street Pharmacy in Mount Pleasant, South Carolina, which was established in 1937 and remains active to this day. In addition to getting your prescriptions filled there, you can still get a lunch or a delicious ice cream soda at the counter. And in 2021, the Pitt Street Pharmacy, as well as other many small independent pharmacies, specialize in compounding medications. I used to get medications there for my cat, who did not like to take pills, and so I was very appreciative of their expertise. When I was in pharmacy school at the University of Buffalo, a big part of our dispensing course was compounding. We made powder paper, suppositories, solutions, creams, and capsules. And New York State had a wet lab as part of the licensure process. And this compounding course came in handy when I was a PharmD student in San Antonio, where I used to make gallons and gallons of Scholl's solution for dialysis patients on Saturday mornings. One thing you might have noticed is that there aren't any women in the photograph from 1922. Pharmacy, much like medicine, was a male-dominated profession for many years. However, women have played an important role in this profession for hundreds of years. Elizabeth Greenleaf is thought to have been the first female apothecary in colonial America, and she opened her own shop in Boston in 1727. Some people have referred to her as the mother of pharmacy, in addition to being the mother of her own 12 children, if you can imagine. The first woman to graduate from the New York College of Pharmacy was in 1863. And I would certainly be remiss if I didn't mention Zeta Mary Cooper, who served as the secretary for the American Association of Colleges of Pharmacy from 1922 to 1942, And she was a major force in the establishment of Rho Chi in Michigan in May of 1922. Looking at my own class photographs, 21 of the 51 students in my BS in pharmacy class were women, which was 41%, which I think is a very good representation in 1973. If you look closely, you might recognize Dr. Chris Sortness from the University of Wisconsin, or Dr. Beth Resman from the University of Oklahoma, two of my classmates. Here we have a picture from 1974 of the first post-baccalaureate Doctor of Pharmacy class from the University of Texas. In my PharmD program, there were 2 women out of a class of 12. Can you imagine what life was like with no internet and no cell phones? There were no personal computers. There were no electronic medical records. We all fought to read the same paper chart before rounds in the morning. If you were lucky, you might be able to read half of the words in a progress note. Pharmacists also had to read incredibly bad handwriting in order to process prescription orders. You either went to the library or subscribed to a print journal in order to read about new diseases or drugs. On the positive side, there were a lot fewer medical journals and a lot fewer drugs. So some ways it was easier to keep up. Clinical pharmacy, or patient-centered pharmacy, was in its infancy. I wish I had $1 for every time somebody asked me what a clinical pharmacist was. I remember Dr. Charlie Walton, who was the director of the program in San Antonio, telling us that we were going to be the change agents for the profession, and we needed to go out and change the way pharmacy would be practiced. After I graduated in 1977, the majority of clinical pharmacy positions were faculty positions. And I remember going to annual meetings of the American Association of Colleges of Pharmacy, where there would be discussions and debates as to whether clinical pharmacy courses and patient care clerkships should be a required part of the curriculum. Now these courses and experiences comprise most of the curriculum, and I'd like to think that my colleagues and I were successful in being change agents. And I expect each of you to contribute and continue to move our profession forward. 20 years ago, the Health Resources and Services Administration projected by 2020 approximately 62% of active pharmacists would be women. And in 2019, 65.1% of active pharmacy practitioners were women. So somebody read those tea leaves pretty well, because I think those percentages are spot on. Now, there have been some notable and interesting trends in the last 10 to 15 years. Some of these trends are good and some are not so good. In 2010, the Bureau of Labor Statistics projected a 25% increase in the employment of pharmacists. That demand was easily met with a number of new colleges opening, as well as the established colleges increasing class size. From 2003 to 2008, the demand for pharmacists was considered moderate, meaning employers had some difficulty filling open positions. By 2013, the increase in the number of pharmacy graduates had impacted the demand for pharmacists. And we can see that there was a definite trend from 2003 to 2013 with the demand for pharmacists decreasing. In 2013, the supply of new graduates was fairly balanced with the employer demand. In 2013, the demand for pharmacists was greater in the institutional setting as compared to the community setting. And we have seen a corresponding increase in the demand for pharmacy residency positions as pharmacy students attempt to make themselves more competitive for these available positions. Unfortunately, the growth of residency positions has not kept up with the demand. And students are also enrolling in other graduate degree programs, MBAs, MHAs, and others to enhance their skills and stand out to an employer. Several individuals started reading tea leaves and voiced concern over the potential for an oversupply of pharmacists. In December of 2010, ASHP and APHA presented a discussion paper expressing concern over the rapidly expanding pharmacy schools' capacities and how that might negatively impact the students' educational experience. In 2013, Dr. Dan Brown published a paper in the American Journal of Pharmaceutical Education expressing concern over the possibility of a crisis of joblessness for new pharmacy graduates with the unprecedented growth in graduates. If we jump to the present, we can see in 2021, the Bureau of Labor Statistics projects pharmacist employment to go down by 2% in 2030. In part, this might be due to increases in automation, mail-order pharmacies, and the increasing roles of pharmacy technicians. And while jobs may not be as plentiful, the salaries are still very good, with a median salary of over $128,000. Perhaps more importantly, the types of activities that pharmacists are engaged in are moving away from solely being a provider of medication and more toward a patient care provider. In 2019, it was estimated that over 50% of pharmacists were providing patient care as compared to 34% being primarily devoted to dispensing functions. Other pathways include pursuing positions that may not require pharmacy licensure or even a PharmD degree, careers in medical informatics, pharmaceutical or medical sales, research, and quality improvement are some of the other options. Every generation is faced with challenges. My generation was trying to change pharmacy from a product-focused profession to a patient-focused profession. And I've seen many changes during my career. The implementation of the entry-level PharmD degree, the expansion of residency programs, board certification in pharmacotherapy, and the consequent expansion of board certification in other clinical specialties. Your generation has faced a monumental challenge. You have endured part of your education and training during the COVID-19 pandemic. In June of 2020, I was precepting my last inpatient rotation when the hospital announced that my pharmacy student would be required to do the last half of the rotation from home. My resident and I split the remaining days to round since only one of us was allowed to come into the hospital. We were all devastated. My heart failure clinic became virtual. My resident and I had to communicate with patients and the nurse practitioners via the telephone. One of the best parts of my job was interacting face-to-face with patients and providers, and that was taken away. Now working from home has some advantages, such as being able to do your laundry at the same time as you work, or saving money and time by not commuting. But not seeing patients, students, or colleagues every day really took away the enjoyment from me. We owe a debt of gratitude to those pharmacists and other healthcare providers on the front line. We learned how important and who really are the essential workers, including individuals cleaning the hospital rooms, people stocking shelves in grocery stores. And after the lockdown was over, we found out how dependent we were on teachers and daycare providers. We also need to recognize the amazing work done by scientists and the pharmaceutical manufacturers worldwide that were able to create very effective vaccines in a very short period of time. Over 8 billion vaccine doses have been administered, yet as of today, there have been over 794,000 deaths in the United States and over 5.2 million worldwide. As a healthcare professional seeing patients, I was very lucky to be able to get vaccinated as soon as the vaccines were available. Unfortunately, my husband had retired and contracted COVID before he could get vaccinated. It was a terrible experience for both of us. The morning I had to take him to the emergency department and drop him off, and not know whether I would ever see him again was frightening. I waited at home and hoped for the best. We were lucky that he was not admitted and he was able to get monoclonal antibodies the following day and eventually made a full recovery. But my heart breaks for those individuals who lost a loved one and who were unable to be at their bedside when they passed away. Pharmacists have played a crucial role during this pandemic. Not only are they administering vaccines, but they serve as a reliable source of information. It's sad that there are so many people that are misinformed. Some individuals are very aggressive and hostile to the very people that are trying to help them. I hope you're not faced with very many of those experiences, but you need to be prepared. So try not to get discouraged. My husband bought me a book many years ago entitled "Don't Sweat the Small Stuff, and It's All Small Stuff" by Richard Carlson. It contains about 100 phrases with little 1 to 2 page vignettes for each phrase. Some of my favorite pieces are: make peace with imperfection. As members of ROCAI, you probably have focused on getting things right, especially on exams, but give yourself permission to make a mistake and cut yourself some slack. My second favorite vignette was get comfortable not knowing. The more I learned, the more often I found myself saying, I don't know. These instances gave me the opportunity to keep learning. The third is surrender to the fact that life isn't fair. It really hurts to see bad things happen to good people. So do the best that you can to make their life a little easier. The fourth is to become a better listener. Don't interrupt others or finish their sentences, and search for a grain of truth in others' opinions. And fifth, become a more patient and less aggressive driver. Some of the other quotes that I've just come across over the years and have resonated with me are the following. One is, keep going. You didn't come this far just to get this far. Again, you've all been very successful in your chosen career. Please continue. We need great leaders. Always be curious, whether it's about people, places, ideas, or processes. Situations won't get better unless they change. To me, this means ask questions and don't be annoyed when other people question what you were doing or why you're doing certain things. And listen to other people's ideas. A third is working hard for something you don't care about is called stress. But working hard for something you do care about is called passion. I worked for 44 years and loved 99% of it. There were times when the required paperwork was annoying, and certainly times when I burnt the candle at both ends trying to meet deadlines. But the people I interacted with at my places of employment and through professional organizations made my career a joy. And I found colleagues that shared a similar passion for pharmacy and patient care. We encouraged each other and celebrated our individual and collective achievements. I wish each of you success in your careers. I hope you have time to find the same joy and passion that I did. I look forward to seeing the changes you will make to pharmacy. I'd like to end by thanking the individuals who contributed to my nomination: Deans Philip Hall and Joe DePiro, Doctors Kathy Chessman, Bill Evans, Leanne Ross, and Kathy Worrell. I appreciate their friendship and their support. And finally, I want to thank my husband, John Basso, whose love and support has kept me afloat for the past 40 years. Thank you.